Top Med Talk.
Well, welcome back to Top Med Talk here at the Intensive Care Society State of the Art Meeting 2018. I'm Desiree Chappell, host of Top Med Talk, and I'm joined here with Monty Mythen, Editor-in-Chief. Hi, Monty.
Hey, Desiree.
How you
Good
doing?
to be back.
Yeah,
Great.
yeah, we're having a great time here. So we are privileged to be able to sit down again, actually with the Pets Therapy group here, and we have three special guests, one that's furry and two humans. So we're gonna
Which one am I?
with them. I don't know. I'm just gonna say which. That probably wasn't the greatest thing.
Just roll with it.
I know they're dogs. This is what brings this. Is
For the record, Alfie is the furry one.
Yeah.
Not me. Yeah.
Okay, all right. So we are lucky to be surrounded by others that are not people, and we have furry little friends with us today. So I've got to stop. So I would like for our guests to introduce ourselves. Suzy, if you can go ahead and start. Let us know who you are, what you do, and who's with you today.
So I'm Suzy Emsden, and I've got my lovely pug Alfie with me today, and I lead a bit of a double life. So I'm a volunteer for Pets Therapy with Alfie, and by day I'm a pediatric intensivist up in the northwest region doing pediatric intensive care transport.
Oh, that's fantastic. Mm-hmm. And how did you get involved with the Pets Therapy volunteer group?
So we first of all got Alfie when my daughter was very ill and found out he had an excellent temperament and was very calm and good at making people feel better. So when she was better, we wondered if we could make him help more people than just my own daughter. Oh. So we contacted Pets Therapy and they sent us some more information. We went through everything that they assess for, made sure that he was ready to go, and then organised an assessment with our local assessor and took it all from there.
Oh, were you familiar with the program? Had you seen this type of therapy in the unit that you worked in?
I'd heard about it. No, I'd not seen it at work. I'd heard about it in other countries and wasn't even aware that it was going on in the UK, and did a bit of delving and then discovered that there were over 6,000 dogs in the UK doing this, and cats as well, and very much wanted to be a part of it and got involved very quickly and found it all very easy and unstressful. It sounds a bit stressful for your dog to have an exam, but it's more like a sort of meeting and seeing how they behave with people and how they behave in situations. And as long as they're like a 15 out of 10 good boy like Alfie, then they're absolutely fine.
He seems like he'd be a 20 out of 20. Cool dog. Well, you were saying that there's a process that the dogs have to go through and animals have to go through before they go into the hospital. And I know that's a lot of concern for not necessarily just the hospital and the patients, but kind of everyone involved, that they might bring in an infection or something like that. So what is the process for the doggies?
So Alfie and I got together with the hospital that we visit, which is Manchester Children's Hospital, and we wanted to make sure, like you say, that Alfie's not bringing any germs in and he's not picking up germs and taking them out. So the night before or the morning before a visit, Alfie will have a bath in Hibby Scrub, which is actually what surgeons use before an operation, but is also vet approved for use in animals. So we'll have a long soak him in a bubble bath and he'll get shampooed with that. He has brand new clean uniform every time, so everything's been through the wash, including his harness, lead, badges swabbed, clean bandanas. I have a clean uniform every time, and then off we go to the hospital. He walks into the hospital, and then in the atrium he has his paws cleaned and sprayed with colloidal silver.
Oh, wow.
And he has an antibacterial mouth gel. And on the wards, we make sure that humans are bare below the elbows, and we don't go into anybody who's barrier nursed, either reverse barrier nursed or infectious. Yeah. And if he's invited to sit on a bed, we get a clean towel per person, and we clean our hands and paws between every patient.
Yeah, that's great. He's probably cleaner than a lot of people.
He probably is, yeah. He probably is.
So sorry, they don't make people put that on their shoes, do they?
No.
If I may just take a picture, he's labelled. Is that a therapy dog? Is that? Just leave it there for a second. I just get picky of it. Is that all right?
Yep.
That's.
He has
He has a hospital ID badge as well.
Can you put that next to his therapy dog? Look at that, it's brilliant. So, and is that the standard? Do all therapy dogs have a therapy dog thing like that?
I think it's up to you. So the bandana is his uniform and the little badge, and he's got his Pets as Therapy ID as well. The hospital very kindly provided him with a hospital ID so that he can make his way around and about without being stopped. And the little harness is just pugs up much better on a harness than on a collar. He has decorated that just so everybody knows why he's here.
I love it. He's like, wait, what's going on? I hear sirens. Yeah.
They hear the sirens.
That is fantastic. So we have another guest with us here who is with Pets as Therapy as well. Please introduce yourself.
Hi, so I'm Matthew Robinson, and I'm a National Project Coordinator for Pets as Therapy. So I work remotely, but essentially looking after various national projects and attending events like this on behalf of the charity.
Gotcha. So some of the questions that I think people would have is that if they're interested in having pet therapy within their facilities, like how should they go about that if that's not something that's kind of on a protocol for them or part of their process?
So what we're hearing is that some hospitals are very concerned, and rightly so, with infection control. We already visit so many, and each hospital has to be kind of dealt with as a separate entity, if you like. We have standard memorandums of understanding that have been drawn up in collaboration with the Cambridge University Hospitals Trust. We use it as a template, and we can work from there and then take on board anything additional that a particular establishment wants us to also do. For example, some might require all the volunteers visiting to be DBS checked, and that's something that they can certainly take up with the volunteer. We're happy with that. They may also have an induction process into the hospital, which, in collaboration with the volunteer, we can also arrange.
Very good. Very good. That is so wonderful. Well, thank you guys so much for sitting down with us. Monty,
can I ask one last question?
Ask
Matt,
it.
I'm thinking about my children getting jobs in the future. What's your background, Matt?
My background?
Yeah. Did you wake
How
up
far do you want me to go back?
Well, did you wake up one day and say, I know what I want to do? I want to run the head office of Pets as Therapy?
No, absolutely not. And actually, I think it's quite an important message to put out there, because I think there's a lot of stress on people coming out of schools thinking, what do I want to do?
Yeah.
And quite honestly, I had no idea. For me, it was the normal thing. Well, I don't really know what I'm going to do. I'm going to go to university.
Okay.
Went to university, came out with a master's in geology, worked for the oil industry.
I can see the
trained
path.
as a teacher.
Me too.
I enjoyed being with people.
Okay, great. There we go.
And no matter what I've done, I've always enjoyed engagement with people and a varied day-to-day life. Ultimately, hospitality led me to Pets as Therapy, because I get to talk to people, I get to run events.
Yeah.
And meet the
help
puppies.
others. Well, being with dogs all day is kind of a bonus. Yeah,
totally.
Absolutely.
Excellent. Cool. Thank you. Thank you for sharing that.
Yeah, absolutely. Well, thank you guys. Alfie, thank you so much. He's like the best chill dog ever. We really appreciate you guys sitting down with us. So congrats on the success of your booth here at SOA. I think you're one of the most popular ones. It is.
We're certainly hearing it a lot from people. They're really glad we're here.
Oh, yeah.
We're really happy to be here.
Yeah.
Hoping we get an invite next year.
I don't know how they
There's a conversation to be had there.
You've already got an invite to some other events, so I have to share it offline.
Absolutely. All right. Well, guys, thank you so much.
Thank you.
Cheers.
Thank you. Thanks very much.
Thanks for downloading and listening to Top Med Talk. Don't forget to find us on social media. We're on Twitter, Facebook, Instagram, even got our own YouTube channel. Whichever your favourite social media feed is, we're bound to be there. Find us. Also, subscribe to this podcast so that you never miss an episode. And make sure you go to the Top Med Talk website, topmedtalk.com, and get on board with the email updates. Oh, whilst you're at it as well, I suggest you download our entire back catalogue. We're categorising it at the moment. We're having a little look through it. It may not always be in the form that you currently find it. So if you get your hard drive ready for a full-on download via the website perhaps, or perhaps through your podcatcher. Oh, and if you fancy meeting us, why not go to the website edpom.org/meetings. Our next big event is EdPom USA, the Dallas Masters Course, a perioperative care practicum. Have a look for details of that and some of the other meetings coming up across the next year. edpom.org/meetings.